All right.
All right, so good afternoon. As Gina already said, Amanda, Paige, Mac, and I are going to be presenting this poster. So my group and I are going to be talking about a systematic review that we did on the effectiveness of physical therapy intervention on low back pain and pelvic girdle pain in the postpartum period. Our advisor for this project was Christine Kalbelka. So pregnancy can put a toll on a woman's body. Women often experience lumbar and pelvic girdle pain during pregnancy and then during the postpartum period. Physical therapy during pregnancy has been shown to minimize symptoms following delivery. However, the effectiveness of treatment during the postpartum period is still lacking. The aim of the systematic review is to determine the effect of physical therapy intervention on low back pain and pelvic girdle pain during the postpartum period.
For our methods, our search was performed from September 2019 to February 2020. We searched PubMed, Ovid, Medline, and CINAHL. Our keyword mesh terms were the same for each database search. From there, the duplicates were removed and all remaining titles and abstracts were screened for relevance to our research topic. There were 50 articles that were then assessed as full text literature for eligibility in our qualitative synthesis. 2 assessors read through each study, and if disagreements arose, they were handled by bringing in a 3rd assessor. In total, 9 articles were included in our study. Our inclusion criteria was encompassed using studies with participants who were within 12 months postpartum with low back, pelvic girdle, or SIJ pain. Studies were excluded due to pregnancy-related complications, long history of pain, pain outside of the inclusion locations, not providing an intervention, subjects who were currently pregnant, radiating symptoms, previous PT for the condition, or insufficient reporting. Qualitative synthesis was completed by assessing for bias, risk, and validity using the Cochrane Risk of Bias Assessment and Pedro scale.
All right, so in this table on the bottom here below the graphs, we summarize the results from the Pedro synthesis, which is a tool used to detect article bias. And scores for our articles range from 6 to 9 out of an 11-point system, with the most consistent form of bias resulting from failure to blind participants, therapists, or assessors. And using this criteria, one study was defined as excellent quality with a score of 9, whereas the rest of the studies can be considered good quality with scores ranging from 6 to 8 on the Pedro tool. And then, as Matt mentioned, we also completed the Cochrane Bias Assessment tool, which isn't shown on the poster, but I'll talk a little bit about. And this system assesses bias as a judgment of high, low, or unclear for a variety of different elements. And from this, we determined that 8 of the articles had an overall low risk of bias, and 1 had a high risk of bias. And similar to the Pedro tool, this analysis indicated the greatest risk of bias resulting from a failure to blind participants and outcome assessors.
All right, moving on to the graphs. The studies that were included in our research had an array of outcome measures. Some of them used were the oswestry, different quality of life questionnaires, and some of them used imaging. There was very little overlap for data assessment. However, all of the studies did utilize and report pain using the visual analog scale. So starting with the top graph in the middle, these 3 studies all utilized a 2-group design with 1 intervention group and 1 control group. The intervention group consisted of stabilization exercise or manipulation. And even though the control group also reduced in pain, the intervention group showed a larger pain reduction. The graph below that includes 4 studies that all used a 3-group design, where 1 group received a primary intervention. They were either exercise or mobilization. 1 group received alternate intervention, and there was 1 control group. Again, the groups that received the primary intervention of exercise showed the greater effectiveness in reducing pain. The last graph on the top right includes just 2 studies that both utilized a within-group design. The studies still showed improvements in pain reduction with the VAS. Rachel, you're mute.
Thank you, Amanda. So just as Amanda said, there was only 1 common outcome measure across all the studies, which makes it difficult to conclude how effective any specific intervention is, but this heterogeneity of interventions made us conclude that there is still a need for higher quality evaluation of interventions in this population in order to inform on best practice. However, regardless of the type of exercise performed, 7 of the 9 studies included exercise as an intervention, which resulted in a significant decrease in pain after treatment. So overall, the review found that exercise in general will help with postpartum low back pain and pelvic girdle pain. So we will open it up to questions now.